My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk again.
Stress and investment coping.
And action. Hey everyone, it's Dr. Rick from Herbal 411. Jerry had a question about medicines changing disease. And because I think he had a really good point, because he has been on medicines and we have been working to make lifestyle changes. But things get in the way. Sometimes my visits get put to the wayside. Oh, that's not good. So it's understood. I mean, if you're a parent, if you're a business owner, if you are sick, if you're taking care of your parents or your kids, so there's a lot of things that get in the way. If you're going through an economic downturn, and this isn't just with Jerry, this is everybody. So there are things that get in the way. And sometimes when you're not in the doctor's office seeing numbers, I don't have an example of numbers, then it might lessen the intensity of you sticking to the program. So this is okay. It's very common to have this. And that's why I think it's important. With a couple of my patients yesterday, I was calling them boring because I didn't have much to tell them. And as a coach, if I have a client that's hit the magic number as far as waist, dress size, BMI, total body weight, cholesterol numbers, glucose, vitamin levels, everything, I have nothing to add. So if life is good and if there's no suffering, I'll see you. I would love to say I'll see you in 2 years, but that just sounds so, it doesn't resonate with me right, because I'm going to forget something. And a lot of crap can happen in 2 years. So I usually keep it at, I'll see you in 12 months. But have my blood test done beforehand, have a good life. I have nothing, so that's boring for me. But the challenge for me as an integrative primary care doc is to get patients to stop suffering. And here's the other challenge, is when you're not feeling anything, usually in my 30 to 40 year olds, you're not feeling anything yet, and it's only in your waist or it's only in your blood test. It's very hard to stay focused on the tasks that I give, especially if you're not going to see me for 6 months. I'm sure as soon as you leave my door, getting to work every day and paying the bills and getting your kids to finish school probably takes a priority over everything else. But listen, and that's why even if you have disease and some other specialist gives you medicines, we have put a Band-Aid. Western medicine is very good at putting a Band-Aid on suffering. So we can put a Band-Aid on pain with narcotics, and this is where that opioid crisis is now. We can put a Band-Aid on inflammation by giving steroids. We can put a Band-Aid on recurrent infections by hitting with another antibiotic. We can put a Band-Aid on elevated glucose by giving insulin. But listen, there's always side effects. Insulin will lower glucose, but it causes weight gain because it changes around the way the liver works. It actually makes you fatter. And if you're fatter, you're going to be worse with your diabetes, need more insulin. That'll cause you to get fatter. So that's just down. It's downhill after that. Antibiotics get rid of infection, but they, at least as far as an acute infection in the chest, in the ears, in the bladder, in the skin, but they also wipe out every good commensal bacteria that's in your gut. And what happens when your gut is ravaged by bad bacteria? It screws up your immune system. And then you get infections, need more antibiotics. Steroids take care of inflammation, but they also give you a false sense of security. So if you don't invest in seeing a physical therapist, massage therapist, chiropractor, exercise on your own, you're going to have another mechanical problem. Unless it's just a traumatic thing that is a one-nighter. So all those things, cholesterol medicine, it'll temporarily lower your cholesterol so your family can't sue me, because I did my job as far as lowering your cholesterol. But if you do nothing to stop the tobacco, losing the weight, exercising, lowering your other numbers, then you will go on to a heart attack. So medicines are very temporary. So I even chemotherapy, if you're granted as a survivor of cancer, I think that it doesn't necessarily. The farther you get from your last chemotherapy, which is usually 5 years, or 5 years, if you make it past 5 years from your chemotherapy, you're usually pretty decent. But I think that the farther you are from your last cancer treatment, the closer you are to your next cancer discovery. So I always say that because what are the side effects of cancer medicines? They cause lymphoma, they cause other cancers. So I think that all the medicines we do are great. Don't get me wrong. I think they do give you a little bit of a leeway or cushion. They do give you a window of opportunity to make the change on your own. But for those of you who aren't driven, I'll have one more example. Guys who have heart attacks and they have stents put in, and the anguishing chest pain is taken care of with a visit and a stent, which takes about an hour, and then a procedure, and you stay overnight or you stay for a day, get a little bit of rehab, you get let go. The pain is gone. The memory of that pain is gone. The visit is remembered because you got to pay the bill, but then the inspiration to change your life is not there. You will go on to, and this is proven, within 6 years have your next stent, and within 10 years have your bypass. Just look at the statistics. So we do a good job at patching up temporarily. Drug companies are making lots of money hand over fist, but I think our country is still sicker. So that's why I would say it's important to put a Band-Aid as far as medicines on your disease process and your suffering, or if you're not suffering, just your numbers, but change the course and direction of where you're going, because we're finding diseases earlier, or let's just say metabolic abnormalities earlier, deficiencies earlier. And if you intervene sooner, you'll have less suffering later. So usually with my guys who are in their late 50s and 60s, some of them, I've heard this before, what's wrong with me? I can't get any better because one disease happens after the next and the next symptom. And it's like, well, there's nothing wrong with you now. We just have to change a couple things. And since you're just too heavy or too out of shape, you have too many bulging discs, we got to do surgery. But if you would have come to me 10 to 20 years ago, I would have told you to do this, this, and this. So hindsight's always great, but if I can take the knowledge that I have with my 50 to 70-year-olds and apply it to my 20 to 30-year-olds, I would, and I do. It's just I sometimes have to beat up some of my young guys and gals because they don't see the big picture coming, if they're a little bit overweight or they're not investing. And listen, I don't tell everybody to be a vegan and exercise 5 days a week and go to sleep and meditate. I don't tell everybody that, but everybody gets a personal design. I think it has to be designed because everybody has their challenges. So, Jerry, in our case, we have opportunity. It's okay. We have opportunity to make some changes. If we don't make any changes in life, in exercise, in nutrition practice, in fasting, in sleep quality, in loving practice, in calming down with nature, whatever, that's okay. But I'm going to have to give you over to my friends. And my friends don't have as much training in calming practice, nutrition, exercise, conservative treatment, herbal medicine, acupuncture. So what are my friends going to do? They're going to slam you with every medicine available for every abnormality found in every blood test and procedure done. That's a lot of crap. And what happens after that is temporary hold. We temporarily hold back the waters, and then another thing comes in the side effects to the medicines we give you. So it just becomes, if you ever see, you guys who have grandparents in nursing homes, take a look at their medicine lists. I've got like 20, and God forbid, there's this lady that she's in hospice now. She's a great lady. She's unfortunately passing away as we speak. But I've had to pull her off all of her medicines, which was kind of like, oh, right. But I had to pull her off because her blood pressures were dropping. She's on her way out, and her body is rejecting all the medicines. It probably should have rejected them a long time ago. So I had to take one blood pressure medicine away. She has ALS, and terrible way to go. But cholesterol medicine away, diabetes medicine away, sleep medicine, and I bet you when I take her off all her medicines, she'll probably feel real good for a little while. So at least we did something for her on her last few days. So this is not the kind of picture I want to have myself. I do not want to be on that many medicines. I don't want to have that many procedures. I mean, I'm knock on wood. I'm doing what I can to beat the diseases that are coming and the diseases that I have. So I will tell you, I have atrial fibrillation. I had atrial fibrillation. I was going to have ablation. I didn't have ablation. I changed my diet. I did acupuncture. I balanced my magnesium. And I'm exercising now different than before. So this is pretty cool, knock on wood. I have irritable bowel syndrome. Usually goes with my fibromyalgia. And I've had fibromyalgia since I was let go by Central DuPage Hospital. Well, I quit Central DuPage Hospital. But since I quit, because I didn't agree with the philosophy of that hospital, I thought I was useless, and I wasn't, obviously, because my patients called me back to Illinois. But I developed depression, multiple trigger points, headaches, and sleep abnormality. And so that led on to irritable bowel syndrome, and got the fibromyalgia licked and under control. The IBS occasionally flares up, but I think I'm getting it under control, and so I'm cool. Now I just have to see what happens as I turn 60 in 3 years and wait for the next crappy thing to come up, but it's okay. Age is okay because there's benefits to aging. However, I invest everything I can now, and I cut out my family life to go exercise. I cut out eating from grandma and auntie's plate. When we have parties, at least I try to curtail it. You can't turn down a plate in a Filipino party. That is so rude. So I hold it. But I still stick to my vegan opportunities. When all else fails, I might have to succumb to rice and some form of beef if there's nothing else available. I tried it the other day. I had it for the first time the other day, and it tasted good, but I got upset stomach the next morning. So again, IBS. I mean, I have a wimpy stomach. So anyway, I'm doing the best I can, and I expect my patients. So when I beat up my patients saying, "Hey, you got to do this, this, and this," why? Because I'm already here. I got the crap kicked out of me when I went through a crisis, and I'm not going to do that again. And I don't expect anybody of my patients to have that happen to them. And if I have to explain what I went through to tell you what you're going to go through, I'll do it. But if I'm going to have to go to this route, I'm going to have to beat you up psychologically to get you to see what's coming. And if you don't listen to me, I'm going to let you loose to the friends of mine. And my friends, again, they like to give a lot of medicines and cut a lot and do a lot of surgeries. So the higher you go up on the scale of specialists, the more medicines and the more advanced the medicines and the more expensive the medicines and the more side effects you'll have. So either you have that or you invest in changing your life. So those of you who are on the fence, or you're not inspired, or those of you who have relatives who aren't inspired and they're getting bigger and bigger because they don't have time, well, tell them to watch this video. Because I can tell you all the symptoms that are going to come with all the medicines you're getting. No medicine will reverse disease. Do not be fooled. The only thing that's going to reverse disease is you picking up your ass and changing where you are now by reversing what you've been doing for the last 20 years. So I hate to say it that way, but now I'm their coach now. I invest all this time to try to make people change, and I can help you with that. If you don't like the way I do it, then get somebody else to do it, but don't just continue on this course. If I have a group of people I'm taking to a summit, I know we're going off course because the map coordinates are wrong, I will stop and admit to it, and I'll ask the group, where do you guys think we went wrong? But I won't keep on going, because I know that if we keep on going, we'll be very frustrated, we're going to suffer, we might run out of fluids, we might get hungry, we might run into predation. So I admit it, and I know because I've been down the road before, both medically and on an excursion. So please take it from me and just try to make the changes, try to get it to resonate with you. If it doesn't resonate with you with the way I present it, find your own way and find another coach to do it. But either way, you don't want the future to be where your kids have to take care of you, or you have to be looking for a caregiver. So try to make some changes, Jerry. Don't feel bad, but get riled up. Change the life so we can get you off all that crap that we're giving you, okay? So those of you who follow me, thank you for following and listening up until now. If you have anybody has any ideas or comments down below, throw them. If you want to fire back at me, bring it. If you agree, then please share this with other people, or let me know what you want to hear. I can do another video, but this was for Jerry. If anybody else benefits from it, then cool. I'll see you at the next video.